All right, the mic's unmuted. It's been a very interesting morning tech-wise. Welcome to the Java Cafe. Today is Monday, November 18th, 2024. Listen, I'm going to jump right in because our guest is not a stranger to the Java Cafe. And if you're familiar with her, you understand she moves in the realm of public health. Public health is a very, you see, I'm stuttering, is a very interesting topic right now. And so I'd like to introduce to some and present to others, Dr. Bisola Ojikutu. I love that I'm able to say her name properly because, again, in these times, things like that matter. And so she is a Black woman who is leading in the space of public health. And so I'm excited to bring her into the Java Cafe. You all go in and say, welcome back. Do me a favor and hit share. I sometimes say like, but we're going to talk about public health. We're going to talk about things around the holidays. We're going to talk about maybe in some context to when I call her Dr. B, when she was with us before, from the report or maybe just in another report, some findings around the impact on Black and Brown communities when it comes to overdoses. We're going to talk about some violence prevention. We're going to talk about RSV, COVID, the flu, the vaccination clinics that the Public Health Commission with other partners are currently hosting. And so please hit that share button. If you're on Twitter and listening and got the headphone in your ear or AirPod, whatever, hit that retweet button because this is some very important information that we need to get out to our community. And so, Dr. B, welcome back to the Java Cafe. Glad to have you here with us. We got a lot to talk about. I said to her in the pre-convo that we're treating today's interview like it's with the mayor, because she's the mayor over public health here in the city of Boston. And so I'm glad that we're able to laugh, Dr. B, and I will set some context. I'm framing this question to you as a public health policy person. Things have moved beyond politics of the past few months. And there, from my observation, is a lot of concern around a lot of public health policy when it comes to fluoride, when it comes to vaccinations, to which we'll talk some specifics in a few. As a public health official, Dr. B, are you concerned on a scale of 1 to 10, 10 being very concerned and alarmed? Can you give us a number and some context as to why?
Well, first of all, thank you for having me. I always being on your show, and I enjoy this opportunity to talk to your listeners and hopefully get good information out there, real information, evidence-based information. So on a scale of 1 to 10, I'm not an inflammatory individual. You probably know I try to keep things, keep it real, but I do try to keep people calm because we can deal with anything. We have weathered the storm previously. I would say that if we just simply look at what may happen in regards to the Federal Department of Health and Human Services, we are at a 10. So, and I'll explain why. So the mission of the Department of Health and Human Services federally is to enhance the health and well-being of all Americans. It's inarguably one of the most important entities of our executive branch of government. Budget of several trillion. I didn't say million, I didn't say billion, several $trillion annually. We're talking about Medicaid, Medicare, FDA, NIH, CDC, Substance Use and Mental Health Services Administration, Health Resources and Services Administration, or HRSA. Irrespective of whether or not you know those acronyms, my point is that this is where governance over health and human services lies in our country. And so now we have an individual who's been nominated to lead that entity, that important entity, who has espoused beliefs that are counter to proven science. And that is incredibly concerning. But looking at your scale from 1 to 10, like I said, it's overarching. I would give it a 10. But here in Boston, here in Massachusetts, I think we have to bring this home and say that I am really not that worried. I am calm. I think we should all be. I think we should recognize that we have wonderful leadership in Mayor Wu and somebody who understands the evidence base, who reads the scientific literature I send her, who believes in science, and who will continue to push forward all of the things that I think are important in regards to public health to support the health and wellness of all Bostonians. So that is my answer.
Dr. B, I thank you for the level set on both ends. One, just being very real about the area of concern, but also we are privileged. I saw Malia Lazu the other day put up a post about being very blessed to be in Massachusetts. We have a governor as well. And let's be very 100, we have you. As someone that's going to be that buffer to that. And so in that, let's start with two areas that you're familiar with that are areas of personal concern and conviction of mine, one of which is mass and CAS, which some label, and the other is violence prevention. Both of them can come under the umbrella, Dr. B, because we are entering the holidays. And it's a very interesting time on the substance use end. Some in this space would call there's a increase of what we call self-medicating. And unfortunately, at both ends, there's an increase with issues of violence because anniversaries, this is the first Christmas, this is the first Thanksgiving, and that is very triggering. Let's also name in the public health space for some, as we're going to talk about trauma services and updates there. There's also still now the impact of COVID-19. We're approaching an endemic, yes, but the impact in many areas we have not fully seen. So a lot there. I have a pen and paper. I told Andrew, shout out to Andrew. I told Andrew that I would do my best to try to stay as focused because we have a lot to cover in the next 20 minutes. And so if I can ask you, Dr. B, you found from some reporting the work of that department that handles sort of those dealing with substance use. This is an issue, Dr. B, that if the mayor's been on 15 times, it's come up 10 in her appearance as well. So one, I'm glad that we have you here as the person that kind of directly oversees this work. But what were your findings? I am aware that there's a disproportionate, well, whenever there's a public health issue in the Black and Brown community, there's a disproportionate impact. But what were your findings in reference to substance use? And if you would like, talk about the holiday increase there, or we can keep both at the end. I'm leaving that sort of to you.
Sure. No, I think that you're connecting issues that need to be connected, and they are connected in many people's lives. So let me just be clear about the data. We know that from 2022 to 2023, there was an increase in overdose mortality in Boston of 12%. And that's in the setting of a decrease that occurs statewide of about 10%. But we can't just look at, sort of 1 year change, and we really need to look just overall, especially when we're talking about how this may be impacting certain populations. So if you take the time period 2019, so pre-COVID, to 2023, overdose mortality increased 124.5% for Black residents in Boston and about 44% for Latina residents. Okay, so there's clearly something that's problematic, okay? And we knew this, and a lot of our work has been focused in on doing just that mass and CAS, if you want to call it, that 1 mile sort of radius, really thinking about what's happening in other areas of Roxbury, Dorchester. We've also seen increase in overdose trends in Mattapan. We really have seen this as sort of a citywide issue. Now, I can tell you the things that we're doing, but I would say that the good news is that when we looked at data January to April, so earlier this year, 2024 compared to the same time period 2023, so we sort of updated our data, what we saw is that overall citywide there's been a 33% decrease in overdose mortality, and there's been more than a 50% decrease for Black and Latina residents. Okay, so there's been something positive that's happened. Now, why? We're working on those specifics, you know what I mean, so we can really tell you why. But what I will say is that what has to have contributed, I believe, is some of the work that we're doing on a public health sort of perspective. So that means that we're getting the word out about naloxone. So we're putting naloxone in public spaces. We are distributing it both through our street outreach teams, as well as EMS, as well as through AHOPE, as well as through other providers around the city. We are doing outreach in Nubian Square. We're really out there doing the public health work to decrease stigma around using harm reduction, which is naloxone is a part of harm reduction.
Can I ask a question? Because that's a new term for me as someone that used to process the console orders for Suboxone there at MGH with I forgot his name, doctor. I can see his face. Is that a new treatment, or is that just
so naloxone actually reverses opioid overdoses. Naloxone or Narcan
versus Suboxone, which was sort of a level of maintenance if someone is going through withdrawal or something like that. I just heard the similarities.
Oh, totally. So Suboxone and methadone are medications used to treat opioid use disorder. Okay. So I prescribe Suboxone. I have many patients who go to methadone clinics. You take this continuously in the hopes that you will, enter recovery. It's a replacement therapy. Narcan, which is the brand name, or naloxone, is a drug that actually reverses an overdose. So if you suspect somebody has overdosed, you can give them naloxone. I wish I had some. Some is in my car. I do not have some right here on me. I could have shown it on the screen. Please go to our website. We have videos. We have a campaign that's on the streets at bus stops about what naloxone actually looks like. And we can also do trainings for people if you're interested. So please reach out to us. But I just wanted to add on to that I think that part of what has happened in many of Black and Brown communities is that there's been stigma around utilization of harm reduction and actually asking for help. But there's also some of our drug supply is tainted. So even if somebody does not believe that they're using opioids, they may be using cocaine or some other, methamphetamine, whatever it is they're using. Our drug supply is tainted. So there are overdoses that are unintentional. And what we're saying is no matter what drug you may be using, if you're purchasing it from whatever source, not from getting a prescription from a doctor, that can be dangerous. So you should have naloxone, Narcan. You should not be using alone, irrespective of what it is that you're using. And so that's been a big thing for us, getting that word out there to people that you cannot assume, oh, well, I don't use XYZ, so I'm not going to overdose. That is an important part of our work.
Dr. B, someone is very familiar with harm reduction. Just a quick shameless plug, as you're in partnership with ABCD Health Services from a harm reduction standpoint. We also have cuffing season as this time of year, around STIs and HIV. I just had to do that shameless plug. But I asked from a harm reduction standpoint, this is very, very real. And if I could put it in sort of simple terms, we understand that there was a fentanyl sort of, when you say tainted, that is the number one thing that comes to my mind. And so are we, from a harm reduction standpoint, saying that if you are in a situation where you are using and whatever around, where you get it from, you might want to have some of this on deck? Is that what we're, just from a harm reduction standpoint, which I believe in saying?
Yes. So, that is what we're saying. So I really appreciate you mentioning harm reduction from many different angles. So harm reduction isn't just about, reversing overdoses. It really is a broad array of strategies to reduce the risk for people who are using drugs. So that risk may come about in terms of HIV infection. So it's about testing people. It's about testing people for STIs. It's about offering people condoms. It's really about engaging people in services in general. It's certainly about syringe exchange, getting clean needles, getting clean works. It can be getting access to smoking supplies, and it includes Narcan or naloxone. So harm reduction is really a wide array of services that we can provide. And no matter what you're using, because we know that our drug supply is tainted, you have to be aware that what you can do is you can get your supply, whatever you're going to use, checked, because we have fentanyl test strips that we offer through our services, both in our mobile van and in our standing sites. You can get it checked and we can tell you what's in it. At least you can be aware whether you use it or you don't use it. And we can offer you access to naloxone. I just want to mention this one really important intervention that we are scaling up right now. We are opening up public health vending machines around the city. Now, vending machine, why would you do that? Well, the problem is that, like I said, there's stigma around using harm reduction. So why not have a place where people can go and they don't necessarily have to be seen necessarily? It's just a place where they can go. So we are going to open up 4 of these inside our locations. So at the men's shelter, and we have a number of folks who are, have substance use disorder in the men's shelter. We have our Finland building. You all know that we have A-Hope there. We have Safe and Sound. We have services that are available there. We have Envision, the Envision Low Threshold Shelter in JP. And then there's a public housing location in Charlestown where they also wanted a public health vending machine. So in these vending machines, anybody can access naloxone or Narcan. There's also syringes that are there, as well as test strips. But each one of these, the group of people who are putting it, who are stocking it, who are working on it, who are trying to engage people while they use these machines, they can actually decide what else they want in there. So it may be that some of them, have condoms. Some of them have PPE, masks, some of them have socks because it's cold outside. Some of them have snacks, and it's all free. So we're trying to make things easy for people to access so that they can decrease the risk for a whole wide array of challenges that they may be facing, particularly for those who are, unstably housed and living on the street and living with substance use disorder.
Dr. B, we have 10 minutes. I will give
Oh, I'm
10
sorry.
seconds. No, you're good. You're good. I'm saying that for me.
Okay.
I mentioned, again, a shameless plug, but as part of the cuffing season campaign, there are kiosks available through ABCD Health Services that you can go and get sex kits in this particular case. And let's just also name, this decreases the stigma of someone that may be what I would just right now real time classify as a quiet user. What my orientation to this space is, high functioning user. You don't appear to, you might want to go and get tested so your family doesn't find out you're dealing with this overdose that was tainted. We're talking harm reduction today. And so I was just excited to hear that model of, you say vending, we say kiosk, all the same thing. Confidentiality is something that is overstressed in the ABCD kiosk. Is that the same here? Just so it's out there in public, are these also confidential?
Yes. Okay. So anybody can access Narcan or naloxone, the drug that reverses overdoses.
Yep.
You do need to register in order to use the public health vending machines just whenever you want to use them. Now, I say that because it's important. Let's just be real here. I think it's very important that we are also working to engage people while they're using, or maybe not the first time, maybe not the second time, but maybe the third time. We're giving them some information. We're finding out what they need. Do you need housing? Do you need to be on a housing list? Do you need to be connected to medical care? What about your mental health? These are things that we don't want to miss opportunities.
It's a catchment model. Let's keep it 100.
That's right. And we're putting these inside, and all of them are inside places where there are some services available, but it's not like it's in a place where you don't feel like there's a privacy involved. But we do try, and we're trying to engage people. So I think that is important.
Dr. B, thank you. And Ms. Teresa, thank you, because I said we got a lot to cover. Just one quick question of clarity, and then I want to jump on RSV, COVID, the flu clinics, and then STIs, violence prevention, SSYI. But Deanna had just a quick question. What is typically each inventory, each box, each stack is different. Typically, what is the shelf life for Narcan? She's had some in her car for 2 years now.
Okay, that's a really good question. And I want to give you the right answer, and I don't have the best answer for you. So let me get that back to you.
And Andrew will get it back to me, and I'll get it to Deanna.
Right. That's right.
Okay.
I appreciate that question.
One of the other areas, I'm going to jump a little bit because this is important to our parents and our children. We're in RSV, flu, COVID, but also vaccination season. It was always vaccination season. Where are we, Dr. B, with these three? And also, if you can, and Andrew, if you don't mind, give me the link to where folks can get the direct information for where the clinics are. Where are we with, when media starts putting out the numbers, you get that little update. I'm like, they're doing that for a reason. Where
Right.
are we? We're going into winter months. Holidays are coming. Gathering. Where
Mhm.
are we with all
So
three?
right. So each year you have to sort of look at the season and know when the peaks are. So we know that for flu and RSV, the peak is between December and February. For COVID-19, what we've seen is that we've had summer peaks. As you know, we had a bit of an uptick, and then we expect that there will also be an uptick in cases and hospitalizations during that same sort of winter, December through February time period. Right now, we're sort of pre that period. If you look at our wastewater data, this is what we need you to follow. It's on the website. It shows you by neighborhood that we're really at low levels in terms of COVID-19, in terms of flu, in terms of RSV. That doesn't, what it means is that, you know, we will come to the peak. We will have increasing cases, but we're not necessarily seeing a peak right now. Okay. And this is true in many places. What you need to be doing now is preparing yourself. You need to get vaccinated. It is important for the flu and for COVID-19. Everyone 6 months or older should get the updated version of these vaccines. We have held free, open, public vaccination clinics throughout October and into November. We're going to schedule some more. These have all been with BCYF. The state has also held these clinics at a number of different sites. The point being that sometimes we all know that it's difficult for people to get online and schedule with their provider, or schedule with the CVS or the Walgreens. We're trying to make this as easy as possible. We will have some new sites posted very soon, and we will get those out to you so that you can put it out to your listeners and then they can disseminate it further. I want to mention RSV just really quickly because I don't think we talk about it enough. So RSV is actually the primary cause of hospitalization among infants. It also does cause very severe illness amongst older individuals and people who are immunocompromised. So we're very lucky that there is a vaccine available for older individuals. That RSV vaccination is not an annual vaccination. It's for everyone ages 75 and older to get one time an RSV vaccine, and then anybody older than 60 who has any increased risk. So any underlying chronic illnesses, respiratory illness, cardiac illnesses, but your provider should be offering that to you. So your healthcare, if you have a grandma, if you have a great aunt, great uncle, whatever, you tell them, go to your doctor. They should be offering that to you. For babies, where I said it is such a big problem with children, we have a vaccine that's given to pregnant women who are going to give birth, and an antibody that's given, a monoclonal antibody given to young infants who are, very young during the period like now when we know RSV is going to be circulating widely. So these are things to talk about with your doctor, but if it's not mentioned, please mention it to them. RSV, respiratory syncytial virus, and say, well, what is my risk? Please let me know if this is something that I need to get.
Dr. B, I want to make sure that folks know that the information is hyperlinked in the comments. And so the first one is, as we were talking about issues around substance use and resources and services, there's a link in there. There's also, if we go further down, you reference to people being able to stay up to date to see where things are as far as the tracking of wastewater. A lot of us found that amusing during COVID, but the reality of it is that is a good resource to find out where things are. And the other thing we wanted to mention, that for the most up-to-date information and also to get information about the vaccination clinics, you can go here to get that information in the comments. Dr. B, of course, we have 3 minutes left at the area that brings me a lot of concern, in which I've moved for a couple of decades now. There are low numbers when it comes to issues of violence. However, because of being in this space, I was recently made aware that more than ever, and we know that systems and structures have issues. The reality that I recently experienced caused me to realize that there's a system, and there's systems and structures that are broken. Within the context of having some of our lowest numbers ever, we can have lower numbers if some of these things are fixed. And so where are we with there's an understanding in this space that the SSYI folks have sort of absorbed some of the work. A lot of folks have concerns about what's perceived as a gap left with SOAR not being here. SSYI has absorbed some of that work. Also in your purview there is trauma response and prevention. There's been some changes there. We're going into the holidays, and if you can round out the substance use, violence prevention, and holidays with the updates, I'll respect you even more, because that's a lot to pull in the next couple of minutes. But Dr. B, I'm very, very, very concerned about what I concretely know are still issues. Same issues and systems, with all due to those that are currently in different people, same issue. Ma'am.
So violence is at the top of the agenda, irrespective of the low numbers. We know that we must prevent, and that we always should be aware of and thinking about how to decrease the risk of violence, whether it be penetrative or other violence in our communities. One of the things that we're doing at the Boston Public Health Commission is that we are amplifying our work and uplifting it and trying to strengthen it by opening an office of violence prevention. Previously, our work was within one of our bureaus, our Child, Adolescent, Family Health Bureau. I think by moving it outside, we are really looking at how we can reinforce the work that we're doing. And it's not just work, as I said, in gun violence prevention. We're really doing capacity building and training, and really looking at trauma. We're looking at domestic and sexual violence prevention. We're certainly looking at communities through the Violence Intervention and Prevention Initiative, and certainly the work with SSYI is ongoing, and it's getting stronger. I think the other piece is the Community Healing and Response Network that you alluded to. This is work that we're really reinforcing and building and strengthening, that I think is really quite important. And I do want to emphasize that there are people working in this space who are really dedicated to doing this work. So Mark Scott, who you probably know, is serving as the interim director. We will be, looking for more leadership in the future. And again, any challenges that we feel the community is facing with this work, we want to hear about it, because we want to respond to it, because like I said, it is certainly a priority. I wanted to add, because I do think this is important, you mentioned the holidays. And I think that the holidays can be a very challenging time for many people. Certainly the financial stress of the holidays, some family stress, the feeling like you have to be festive, even if you don't feel festive. I think that can affect all of us. And I think that it's really important to take time to yourself, to be alone sometimes if necessary, to breathe, to take a walk if the weather is good outside. But I also want you to recognize that there is something called seasonal affective disorder. And that is that's a form of depression. It is a mental health issue. It's a mental health disorder. And if you are feeling as though, you're not sleeping, you may be gaining weight, you may be eating more, you may feel low and not get joy out of anything, then you really need to see someone. You need to talk to someone. You may need medications. You may need to think about other forms of therapy, whether that's psychotherapy, whether that's light therapy. The reason the seasonal affective disorder happens is because it's darker outside. It gets darker early. It's cold outside. People don't interact as much. They don't get the important social interactions, they're not necessarily getting that. So realize that, yes, a lot of us are struggling with a lot of things. Reach out and get some help before you think about, self-medicating, before you think about anything else. Reach out and get some help.
Dr. B, thank you. I'll make sure, we can quickly reference numbers like 988. A quick number, yes. If you want to find out what the Health Commission is doing, you can call 311 and they can direct you over to the Health Commission and get some information as well. But if you're in a point of crisis, 988 is always the number to call. Dr. B, I'll end with this because, it's 1032. On that violence prevention piece there, as someone that has been in this space a while, I understand that the more we get updated data, that does cause influence on systems and structures. That's the belief in the positive framing. However, and again, away from individuals, systemically, it just is interesting to observe that, updates that are going to improve impact are happening. I will say this, that the good brother Scott can well make you aware, because one individual, it's not about individuals, but one individual that's been along this ride with us in different iterations, but has been around and ascended is Mark Scott. And so he can definitely abreast. And I will say to folks, when I mentioned this to Dr. B, immediately she said, Jimmy, let's set some time to talk. So thank you for that. But we look forward to updates, particularly in that area, and the cohesion that needs to happen just across all divisions and departments that have any and everything to do with issues of violence, prevention, intervention, and in the worst case scenarios, response to trauma. Dr. B, I appreciate you, Andrew, and the team there. Andrew, if you don't mind, connect me with Anthony. And one will also follow up with Deanna, Dr. B, and thank you for all that you're doing there. We send strength your way as our, Doctor, you know I'm serious. As the initial buffer, then we got Doctor Lord Jesus, our mayor, our governor, and all the public health officials who believe in the science. We send strength and some joy your way, because I know these are interesting times for many. Dr. B, I appreciate you. Thank you so much, and Andrew as well. Thank you.
And thank you so much, and I appreciate you.
Thanks, Dr. B.
Thank you for all that you do.
Yes, ma'am. Folks, oops, I got her off too early. I sorry about that. I definitely appreciate Dr. B being with us. I am noticing that my shoulders are up, so I'm aware. That is a particular area, and someone that's been in this space for decades, couple, maybe three, over two. We know what happens during the holidays. So thank everyone for joining us this morning. We have a great lineup scheduled for you for the rest of this week. I'm excited to share with you that tomorrow we are bringing in Nicole Colbreth, who works in the space of just supporting young people. She has a product out called Quick Lid products. And so she'll be with us on tomorrow. And then on Wednesday, there is a shot of Java. Will be back with me and update some commentary. We'll talk about the Tyson fight. Some of these, I don't know whether to say 45. I call him the rapist, racist liar. Some of these appointments that are going on. And also on Thursday, as November is Native American Heritage Month, we are going to speak with the Chappaquiddick tribe of the Wampanoag Indian Nation. They are going to be with us on Thursday as well. Some of their leadership and members of the tribe. And so we are doing that this week. I think that is it. There's no other programming scheduled outside of the show for the remainder of the year. We may do an in-person Christmas. I'm figuring that out. I just wanted to also mention, and I'll be those that I need to sidebar and you know, let know. Dr. B reference to it. Also my guest, Dr. Lord Jesus, Dr. Sonia, I can't remember her last name, but Dr. Sonia from yesterday, last week, that talked about the finances and then dipped into a little prophetic when she was on. I am getting ready to really take a break. We're doing the show, handling all meetings that have to be handled. But when I say everyone, friends, family, outside of what I have to do for work and maintaining things. So if you reach out over these next few weeks, it's not personal. I'm not being wonderful. And I've been hearing the voice of my father. Let me kill the devil. I'm not going to give it that much energy, but don't really have to say it. But as you know, I understand my role. But I'm also understanding managing expectations so I can be, as Dr. Sonia said, Sonia, as she pronounces it, my best self. And she talked about it. She said, if you're not your best personally and professionally, it affects us. And that thing hit home. And so I'm just being, I'm putting it out there like that. That way, Well, I'm seeing a bunch of comments from about Narcan. Okay. Let me just address a couple of the Narcan things. So, Anissa, I definitely need some more context. Yeah, I was so thrown off when doctors gave me Narcan to bring home, but realized it's more for for community emergencies. I guess in case you witness something. Miss Teresa mentioned when I was given narcotics when I was discharged from the hospital, the pharmacy automatically gave me Narcan. Okay, so we're realizing a practice here. All right, so I'll end with the one from the Real Boston Media. Miss T, thank you. You know you'll get a sidebar. Charlotte, thank you. Charlotte has something coming up. Make sure you all go like and follow. She's talking about with some men from a couple of different perspectives as the person that oversees health, the health ministry at Greater Love Tabernacle, and to the Real Boston Media's. Wait a minute, hold on. I might be getting in trouble. Yeah, I'm sharing that sort of openly. That way, if folks are reaching out, if the little buzz the little buzz that's already out there expands around, me trying to be wonderful, because the truth of the matter is, if y'all leave my calendar and meetings and my inbox just to me, it ain't gonna work. And so that's where things are. Sister Michelle. I never call her that. My brother James, 100% understand. Take the time for self-care. I'll be taking off every other Monday from RYI to process through my compound sorrow. Loved ones making their eternal transition. August through Veterans Day, and maternal cousin currently in hospice care in ATL. Let's keep each other in prayer and rest for rejuvenation. Absolutely, sis. Thank you so much. My mother says, well needed. And let me say something publicly to my mother and some other close folks. Some stuff, when it comes to schedule, I know me, and we'll do it in text, and we'll put everything in text. And I literally will leave iMessage, close it, get ready to go to Outlook, put it in. A notification is there, email, something pops up. 2 weeks later, Jimmy, where you at? Huh? And so anyone, but especially my mother, but anyone close, if ever, it's a little businessy or someone's reaching out. I'm going to behave. If someone reaches out to you and it has a non-family, non-you tone to it, and I ask you to let them know or hit Anissa, please, it ain't about you. It's. And so I just want to publicly say, because I'm aware of not her, but my mother protects me. And in that protection, it could be perceived as, oh, he's putting his mother to. So, little out there. I love you too, Ma. Operating on 70 leaves 30 of your best potential not to be seen. Always remember, Mr. Java, aim for 100 effort with 100% energy. I know. Yes, Ma. I'm not being messy. I'm getting off of here. You all have a great Monday. We're going to wrap up. It's Mental Health Monday. And again, I'm going to challenge the 92 people that are over on Twitter. Click that live chat and put one word in the live chat to let us know how you're doing mentally today. Today's Mental Health Monday. My mental health was bugging because the cameras were acting up. Let me see if I can switch the camera back. All right. Dr. B is off. And that just looks a little bit better. I like the it's flashing in the background, y'all. I'm going to get ready to get off of here. Michelle, love you too. Twitter people, put one word in the comments that let me know how you're feeling today. Click the video that you're watching or listening to right now. And then below that, something, a live chat. Wait a minute, where's it at? Oh, below that, See that thing that says live chat? Right there. Put one word in the comments. Nisi said that she's feeling very good. That's 2 words, Nisi. Michelle said meditative. Meditative. I think I got it right. All right, y'all give me a couple of words so we can get ready to wrap up for today. Shout out to all the UCB members. You all get an hour today for joining Java with Jimmy. Twitter, I'm looking. I don't see y'all, no comments over there. Another thing, I have some contractual requirements that I need to finish out that include me advertising and doing some things on Twitter. But I'm letting y'all know now, more than likely in the next few months, I will probably delete my Twitter account. That space has changed. Oh no, now Nisi's going with 3. Very good and excited. Asia, good morning. Thank you so much. Yo, did Raymond win? Did he place? Asia's husband Raymond was in a chili contest yesterday. Asia, let us know what happened. Miss Teresa, I ain't messing with you. I think that is it for me for sure. Asia said delete. She sent me some links to some other platforms and whatnot. So I'm definitely going to think about that. But I have to, there's some contractual requirements that cause me to have to interact with Twitter. But when those are over, the earliest is the end of January. So maybe sometime in February, we'll be letting you know that we don't go look for us over on as much as these 95 people over here on Twitter are watching right now. Gonna let you go. He placed 3rd. Shout out to brother Raymond Heath for placing 3rd in the chili contest that happened yesterday. A lot of great folks. Some men were cooking, and so shout out to brother Raymond, who is the not better half, the better 100 of the Heaths. Both of them are 100 in themselves, so they just make themselves 100, period. But shout out to brother Raymond. And Miss Teresa, don't you send them scrolls over here. Where's Sharon Cornelius? Sharon Cornelius, where you at? I didn't see you. I didn't see no coffee cup in here this morning. She must have just hopped on. Oh, there she is. Hi, Sharon. Good to see you. Hi, Donna Williams Bowen. Pastor Marion. Oh, I missed a lot of people. Sister Debbie. You know, when Dr. Bisola and Pam, good morning. Good to, oh God, I miss a lot of folks. Good to see you in the room. Folks over on Instagram, I'm so sorry that I did not ask a couple of questions there. Gregory, ONS, Brother Brandon, Dante is over there as well. Shout out to the folks listening over on Garth as well over on Instagram. Madeline, sorry I did not get to ask your question. When I get the response from Dr. B about Deanna's question, I will do my best to remember to ask your question over there as well. All right, folks. All right. Good to see you all this morning. We'll see you guys tomorrow morning as we talk with Dr. Colbert about Quick Lid Productions, and see you guys tomorrow at 10 a.m. Have a great day, everybody, and we will talk to you soon. I think I got everything. And tomorrow morning, 10 a.m., we shall see you then. All right. Peace, everybody.